Have you ever wondered how to treat hemorrhoids without undergoing surgery? Is it possible to find effective solutions to this discomforting problem? And most importantly, did you know there are different treatments for different types of hemorrhoids? The worst part is that often we might be living with hemorrhoids without even realizing it. If you've ever questioned this video is especially for you. I've brought the best non-surgical hemorrhoid treatments you need to know right now. I'll reveal the solution to treating hemorrhoids without resorting to scary surgeries, and I'll also share with you a list of the 7 most forbidden foods to be avoided during a hemorrhoid flare-up. This list will be numbered from least important, number 7, to the most crucial, number 1. So, I invite you to stay until the end to discover which foods can exacerbate hemorrhoid symptoms and why. Hemorrhoids can become a real nightmare if not treated properly. It's surprising how the pain and discomfort caused by this condition are more common than many people imagine. Imagine waking up in the morning and feeling an unfamiliar pain in the anal region. Have you ever wondered if it could be a hemorrhoid manifesting for the first time? It's normal to feel afraid in the face of this possibility. It's important to note that there are different types of hemorrhoids, some more painful than others, and there are those that remain silent, causing discomfort in daily life. Throughout this video, you'll learn to identify and treat each type, discovering how to relieve this discomfort once and for all. Now, let's get to the content. Don't forget to leave your like on the video, subscribe to the channel, and activate notifications so you don't miss any updates. The Intestinal Life channel specializes in intestinal health, and here you'll find the best tips for a healthy intestinal life, free from worries. Firstly, it's important to understand what hemorrhoids are. They refer to small blood vessels located near the anus and are present in all of us. However, in some people, these vessels can lose firmness and start to protrude outward. Additionally, there's hemorrhoidal thrombosis, a condition in which these vessels can form blood clots, resulting in discomfort. Imagine the following situation. You're going about your daily routine when suddenly, an uncomfortable pain arises in the anal region. This can occur for various reasons, such as straining during bowel movements or even improper body movement. This is the moment when the well-known little ball forms in the anus, characteristic of hemorrhoidal thrombosis. Here's the crucial point. How to prevent this situation from escalating into something more serious, like surgery? To address this issue, let's divide it into 2 distinct situations. Those who deal with hemorrhoids frequently and those who are experiencing an acute crisis. Starting with the case of an acute crisis, it's essential to consider the intensity of the pain. If the little ball appears and gradually disappears without causing significant pain, there's no reason for alarm. Often, a simple medical consultation and some guidance are sufficient to resolve the issue of hemorrhoids. However, if the pain persists, the situation becomes more delicate. Ignoring the symptoms is not recommended. It's crucial to seek medical guidance to avoid more serious complications. Fortunately, there are several measures that can be taken to alleviate discomfort and prevent more serious problems. Don't worry, I'm here to provide the appropriate measures to prevent this discomfort from worsening. The key lies in simple yet effective actions that can be initiated immediately to take care of intestinal health. The first step is to avoid trauma to the affected area. Additionally, it's essential to ensure the proper functioning of the intestines without causing harm. How to do this? A balanced diet plays a crucial role. It's necessary to include an adequate amount of fiber in the diet and maintain good hydration, especially with water. Fiber is present in a variety of foods, such as leafy vegetables, roots, seeds, and fruits with peels. Moreover, whole foods like bread, pasta, and brown rice are excellent sources of fiber. Adequate fluid intake is essential for proper bowel function, so don't forget to drink plenty of water. Another measure that can be very useful is sitz baths with warm water. After the first 48 hours of discomfort, this type of bath can expedite problem resolution. You can perform it from 1 to 4 times a day, using warm water and, if desired, adding a small amount of salt, as mentioned in previous videos. These simple actions can make a big difference in your intestinal health, preventing future complications. Baking soda can be a helpful ally in the treatment of hemorrhoids, but it's crucial to use it in small quantities and avoid excess. Its application can help reduce swelling and contribute to problem resolution. However, it's important to keep in mind that hemorrhoidal thrombosis may take time to be absorbed by the body, resembling a bruise in the area that goes through different stages of discoloration before disappearing completely. In the area around the anus, the clot absorption process is similar. The presence of this clot may hinder swelling reduction, making the recovery process potentially slow. However, over time, discomfort tends to gradually decrease until it disappears completely. Additionally, there are creams and ointments available in the market that can be useful in speeding up recovery. It's important to note, however, that many of these ointments only treat the symptoms and not the underlying cause of the problem. If the case is solely thrombosis, the ointment may not completely resolve the condition but can provide relief for mild symptoms. However, caution is essential with the prolonged use of certain ointments, as some may cause problems if used for an extended period. This issue was discussed in detail in a previous video, so it is recommended to revisit that material for more information on the proper use of anal ointments. Currently, there are ointments on the market, especially compounded ones, that can expedite the resolution of hemorrhoidal crises. However, their improper use can lead to serious consequences. These ointments, with anticoagulant properties, are designed to help dissolve clots, offering an alternative to resolve the condition more quickly without the need for surgery. In the presence of a painful hemorrhoidal crisis, it's important to note that the intensity of pain may vary from person to person. Generally, it lasts for a short period, from 4 to 7 days, before gradually improving. During this initial phase of pain, there are measures that can be taken to alleviate discomfort. Sitz baths with cold water can be soothing, as well as the use of anesthetic ointments formulated specifically for hemorrhoids. In some cases, ointments containing corticosteroids may be recommended as they help reduce local inflammation. It's important to remember that the use of these ointments should be for short periods and as directed by a healthcare professional. Additionally, during this phase, a medical consultation may result in the recommendation of procedures such as thrombectomy, which involves the removal of the clot. Depending on the severity of the situation, this procedure can be virtually painless, especially if the clot has broken through the skin, making its removal with simple compression easier. One approach that can be adopted is to make a small cut, a minimal incision, to assist in draining the clot, a procedure known as thrombectomy. It's worth noting that this is not a surgical intervention to treat hemorrhoids, but rather a measure that relieves local pressure, facilitates clot emptying, and can provide significant relief. However, it's crucial to emphasize that one should not attempt to perform this procedure at home. Attempting to pierce the hemorrhoid in a domestic setting can result in copious bleeding that does not easily cease, potentially requiring emergency surgical intervention and increasing the risk of local infections. Therefore, it's essential to seek appropriate medical attention. By following these measures correctly, it's possible to avoid the need for surgery in patients experiencing hemorrhoid crises or hemorrhoidal thrombosis. It's important to remember that hemorrhoidal thrombosis is an acute condition that tends to resolve gradually over time. Often, patients report having recovered using certain products, as the hemorrhoid crisis naturally diminishes and resolves on its own. Thus, in most cases, surgery is not necessary. With the use of appropriate products and sitz baths, it's possible to resolve the problem, and the patient is free, potentially never having to face this condition again. Sharing methods and experiences on how to resolve hemorrhoids is common, but it's important to recognize that there are different situations beyond acute crises. A patient experiencing recurrent symptoms in their daily lives is the primary candidate for surgery. Let's now explore the non-surgical options available to avoid the need for surgical intervention. As mentioned, hemorrhoids are a condition present in the daily lives of some people. They result from the descent of blood vessels located within the anal canal, above a line called the pectinate line or dentate line. This line marks an anatomical division of the body with different embryonic origins for the regions above and below it. The distinction between internal and external hemorrhoids based on their embryonic origin is crucial. Internal hemorrhoids, located above the pectinate line, have innervation similar to that of intestinal mucosa, which means they generally do not cause acute pain upon touch. On the other hand, external hemorrhoids, located below the pectinate line, receive innervation similar to that of the skin, being more sensitive to touch and perforations. This distinction is crucial because it significantly influences the available treatments, whether surgical or non-surgical. External hemorrhoids are located below the pectinate line, but part of them may extend into the anal canal, as illustrated in an anatomical diagram. It's important to understand that a part of the hemorrhoid may be erroneously interpreted as internal when it's actually external. There's an essential distinction between external and internal hemorrhoids. The external hemorrhoid is located below the pectinate line, while the internal one is above. However, it's possible for the internal hemorrhoid to protrude when a person strains during daily activities, such as defecation. This phenomenon is more common in grade 2, 3, and 4 hemorrhoids. Now let's move on to the clinical treatments available to resolve hemorrhoids. The first step, as mentioned earlier, is to ensure good intestinal function. Straining during daily bowel movements, whether due to very hard or very loose stools, can result in increased pressure on the hemorrhoids. This increased pressure can lead to the enlargement of hemorrhoids and even their protrusion. Hemorrhoids that have lost their natural support are susceptible to this type of displacement when there's constant straining, which can progressively worsen the condition. Therefore, it's crucial to adopt measures that promote healthy bowel movements and avoid straining during defecation. This can be achieved through a fiber-rich diet, which helps regulate bowel function and prevents constipation. Additionally, it's essential to stay hydrated, as adequate fluid intake assists in the formation of soft stools and facilitates the defecation process. Care for intestinal health is fundamental to prevent worsening hemorrhoids and provide relief from symptoms. A fundamental step in treating hemorrhoids is ensuring good intestinal function. This can be achieved through a fiber-rich diet, adequate fluid intake, and regular physical activity. This is the first and most important step because good intestinal function reduces trauma and straining during defecation, which helps to prevent complications. Furthermore, there are other measures that can be taken to improve comfort during defecation. Recently, I discussed in a video the practice of elevating the feet during bathroom visits. This technique, often called the squatting position, can be beneficial because by squatting, we relax the pelvic muscles and align the rectum, facilitating defecation. For some, it may seem like an irrelevant practice, but the fact is that by adopting this position, even on a conventional toilet, the defecation process tends to be smoother and more efficient, reducing the need for straining. It's recommended to use a footstool, such as a stool or a bathroom trash can, to facilitate this position. However, it's important to emphasize that one should not squat directly on the toilet, as this can cause serious damage. It's preferable to use an appropriate foot support. If you find that this practice isn't resulting in significant improvements or is causing discomfort, it's advisable to discontinue it. However, this more appropriate position during defecation may help reduce straining and, consequently, the risk of developing hemorrhoids, thereby helping to avoid the need for surgery in the future. An important recommendation for those suffering from hemorrhoid problems, which would actually be ideal for most people, is to avoid using toilet paper when defecating. I've already addressed this issue in a specific video on the correct way to clean the anus. In the video, I emphasized that even those with firmer stools that soil the paper less could use it. However, for those with hemorrhoids, it's crucial to avoid using toilet paper. This is because hemorrhoid tissue is quite fragile, and the use of toilet paper, even of superior quality, can traumatize the area, trigger crises, and increase inflamed tissue. Moreover, as the paper is dry and the anal region is often dry and injured, using dry paper on this delicate mucosa is not ideal. The recommended alternative is to perform hygiene after using the bathroom by carefully washing the area. It's important to avoid using showers with very strong jets, as this can also trigger crises and traumatize the tissue. Instead, one can opt for the use of moist wipes, which offer a gentler alternative for cleaning the area. I recommend using moist wipes specifically for newborns, without perfume and alcohol, to avoid worsening symptoms. This is an affordable option that can be easily done at home. If you're away from home, it's advisable to use moist wipes when defecating outside the home environment. Although it's a taboo topic for many people, it's important to overcome this fear, always remembering the importance of using appropriate bathrooms and taking proper precautions. Another option for dealing with hemorrhoid symptoms is the medications available. However, it's important to note that these medications provide temporary relief and do not represent a definitive solution. Ointments, for example, are especially useful during crisis moments. If the use of these ointments becomes frequent, it's a sign that the condition isn't under control and medical attention is necessary. In addition to ointments, there are other medications, such as flavonoids, that can help reduce swelling and the size of hemorrhoids. If you're experiencing a hemorrhoid crisis and the situation is urgent, there are options that can provide temporary relief of symptoms. For example, specific medications can help reduce swelling and improve symptoms during the crisis. However, it's crucial to understand that this treatment is temporary. If symptoms persist after discontinuing the medication, it's important to seek medical attention for proper evaluation and guidance. Additionally, there are non-surgical alternatives for treating hemorrhoids. One of them is office-based procedures. An example is rubber band ligation, a method widely used and well-tolerated in medical literature. This procedure is especially effective for grade 2 hemorrhoids. Although many people report feeling discomfort during the procedure, it's generally tolerable and usually doesn't cause severe pain. However, it's important to be aware that there may be a sensation of pressure or discomfort after the ligation, along with the need for proper care during the recovery period. It's essential to understand that while non-surgical treatments have their advantages, such as lower risk of complications and faster recovery, there are still possible side effects, such as pain and discomfort during and after the procedure. Therefore, it's crucial to discuss with a healthcare professional all available options and their respective benefits and risks to make the best treatment decision for each specific case. There are several non-surgical treatment options available, such as infrared coagulation and sclerotherapy, which can be performed in a medical office to relieve symptoms and reduce the size of hemorrhoids. These interventions represent valuable alternatives for specific cases, offering a less invasive approach to treating the condition. In situations where non-surgical treatments are insufficient to control symptoms or reduce the size of hemorrhoids, it may be necessary to consider more invasive procedures. In these cases, it's essential to explore all available options and discuss with the doctor the best approach for each individual case. Avoiding surgery whenever possible is desirable, as it can be avoided in many cases unless there are severe complications that require immediate intervention. For more severe cases, such as grade 3 or 4 hemorrhoids, which are large and do not respond to non-surgical treatments, surgical intervention may be necessary. Although it's not an emergency surgery in most cases, it's important to schedule it to ensure the best possible outcome. It's crucial to understand that each patient is unique and that the ideal treatment may vary depending on the severity and individual characteristics of the condition. To ensure relief during a hemorrhoid crisis, it's essential to know the foods that should be avoided. I've compiled a list of the top 7 forbidden foods during a hemorrhoid crisis, from least important to most crucial. The top 2 is certainly in your daily diet, hindering your recovery. So stay tuned until the end to discover the most important one and get rid of hemorrhoids once and for all. 7. Carbonated beverages. Although they may seem refreshing, carbonated beverages like sodas can be harmful during a hemorrhoid crisis. The carbonation in these drinks can irritate the intestines, leading to increased inflammation and worsening hemorrhoid symptoms. Consumption of carbonated beverages should be avoided to minimize discomfort during a crisis. 6. Aged cheeses. Foods high in fat, such as aged cheeses, can challenge the intestines during a hemorrhoid crisis. The high amount of fat in these cheeses can irritate the intestines and anal region, especially in patients with lactose intolerance. Avoiding the consumption of aged cheeses can help reduce inflammation and promote faster relief of symptoms. 5. Gluten-containing foods. During a hemorrhoid crisis, it's important to avoid foods that may trigger inflammation and discomfort, and gluten-containing foods fall into this category. Foods like bread, pasta, and cereals that contain gluten can irritate the intestines, worsening hemorrhoid symptoms. Opting for gluten-free foods can help minimize inflammation and promote comfort during a crisis. 4. Seafood. While they may be a delicacy for many people, some seafood can trigger irritation and inflammation during a hemorrhoid crisis. Seafood such as shrimp, shellfish, and mollusks can be especially problematic for those dealing with hemorrhoids due to their ability to irritate the intestines and worsen symptoms. Avoiding the consumption of seafood during a hemorrhoid crisis can help prevent discomfort and promote healing. 3. High-fat foods. During a hemorrhoid crisis, it's crucial to avoid high-fat foods as they can disrupt the intestinal flora and worsen symptoms. Foods like pizza, ice cream, hot dogs, burgers, French fries, and fast food meals are examples of foods to be avoided. Consuming these foods can lead to constipation or even episodes of diarrhea, further worsening the hemorrhoid condition. 2. Caffeine-containing foods and beverages. These are very popular foods. Surely you consume at least one of them in your daily life. For many people, a cup of coffee or a chocolate bar are essential daily elements. However, during a hemorrhoid crisis, it's important to avoid caffeine-containing foods and beverages. Coffee, green tea, yerba mate, chocolate, and cola sodas are examples of foods and drinks that can irritate the intestines and worsen hemorrhoid symptoms. Opting for caffeine-free alternatives can help reduce inflammation and promote healing during a crisis. 1. Red pepper. Capsaicin, the main active component of red pepper, can significantly increase discomfort and burning for those with anal fissures and hemorrhoids. During a hemorrhoid crisis, it's crucial to avoid spicy and seasoned foods containing red pepper. Consuming these foods can worsen hemorrhoid symptoms and prolong recovery time. Opting for mild and non-irritating foods is essential to promote comfort and facilitate healing during a hemorrhoid crisis. If this is your first encounter with our channel, I invite you to explore our other videos. Learn how to identify your stool type and what it says about your intestinal health. I also recommend watching our video on intestinal worms and how to get rid of them once and for all for a healthier life in all aspects. Don't forget to subscribe and like the video. Your interaction helps this content reach more people and encourages us to produce more valuable content here on the platform for free. So share this valuable information with those who can benefit. Let's together spread knowledge about proper hemorrhoid treatment for a life without suffering. Thank you for your attention and see you in the next video.